oh my gosh, I feel so dumb. I don't know these things, but no one taught me. Especially A&E, it's a fast-moving department. Some of your coordinator might pressure you to like, hey, move this patient, but you're the nurse and that's your pin. If you don't think that patient is safe, then don't move it. Hi guys, it's Danica and welcome back to my channel. To those who are new to my channel, welcome. My name is Danica. I'm a registered nurse in the Philippines and also here in the UK. If you're new here on this channel, then I encourage you to click on the subscribe button below and also the bell button beside it so that you will be notified every time that we have an update. So guys, for today's video, I will be talking about my top 2 tips for you foreign nurses coming here in the UK. So a bit of a background before we finally begin. You know, when I came here in the UK, I didn't have any relative or like friends, so I just came here all by myself and I didn't know what to expect. You know, at that time, probably when you're processing, you know, going to abroad, you just wanna like really finish the process. Sometimes you kind of forget like what to expect, and you know, you don't have anyone to give you advice. Like, you can search on the internet probably, but I think it's still different when someone who's actually working here will give you the first-hand advice of, you know, what you need to know about it. So this one is actually an advice for nurses in general, but this would be in terms of nursing, so practicing nursing in a foreign country. So this applies for everybody. It's not just for Filipinos, but for Indians, Chinese, or other nationalities that will go here in the UK. So guys, again, this is just based on my experience. There's so many advices that I could give you, but I think this would be the top 2 advice that will save you, or probably the 2 things that you just need to remember and you'll be safe here practicing nursing in the UK. So yeah, let's begin. So my first step for you guys would be, don't be afraid to ask. Let me elaborate on that. So of course, when you're new here, for me personally, because it's my first time going abroad, I'm kinda a bit afraid of practicing nursing in terms, like, in the fact that this is a different country. They have here common diseases that are not common, so it might be something new for us. Even the drugs kinda differ a little bit and how they actually administer it. Even when treating patients, you should be very careful with that. So yeah, it's kinda a bit scary initially, so ask, because it's a new country, so they don't expect you to know everything, and that's fine. There you go, there's an ambulance. Okay. Okay, now that's clear. So yeah, don't be afraid to ask. When I was new here, I keep on asking a lot of things, and I think when you're new, ask. So it's okay to ask once, then rather than assuming that you know this stuff. So I had no troubles asking my colleagues, even the doctors. They're very nice. They won't like judge you, you know. Most of them, most of the people, you know, you can't please everybody, and like not everybody's nice, you know. But I mean, in general, they don't have problems when you ask, especially if you're new, because you're still learning stuff. So even like preparing meds, like, oh my gosh, you know, the first time I actually was trying to prepare an IV antibiotic, I was like, what am I supposed to do? Like, they have here BNF, wherein you can consult that book to see how you actually administer this drug. So be very careful. It's kind of different on how we administer drugs in the Philippines. Also, you know, even the slightest, even the simplest thing, like for example, the trolley or the medical bed, I don't even know how to manipulate it. It's kind of like, oh my gosh, I feel so dumb. I don't know these things, but no one taught me. Like, they wouldn't like orient you everything. You just need to learn it as you go along. So yeah, don't forget to ask. So yeah, I think being able to ask is very important, especially if you're new. Just learn everything by asking. If you're not sure, ask. Don't pretend that you know everything. It's fine. It doesn't make you less of a nurse. I know it may feel like maybe downgrading, or you might feel dumb, like, what am I supposed to do? But hey, this is a new country and they have new protocols, policies, and stuff. So that's fine. So again guys, number one tip, don't be afraid to ask. Okay guys, so moving forward would be my second and last tip for you. So this is a broad thing. So number two tip would be safe. So when I say be safe, it's like mixture of different stuff. So let's begin. Be safe in terms of be safe literally. Like, don't be a superhero. For example, here there's mental health patients, or there's patients that's aggressive or confused patient, and you know that they tend to like maybe like punch or like, you know, bite you or stuff like that. Don't be a hero, please. So if you feel that it's a threat for you guys, don't go near them, or go with someone else, with another staff, especially if it's a side room, or call the security or police in extreme cases. So that's fine, just be safe. Be safe. So it's different here because you might be asking me like, why are you talking about mental health patients? So I'll try to make vlogs about it, because it's not just patients who's actually physiologically sick here, but also mental health patients go to the hospital. Even drug overdoses, alcoholics, they go to the hospital. So it's a different setting, not like in the Philippines that you won't see alcoholics in the hospital. It's a different thing here. So always be safe in terms of harm. So next would be safe in terms of practicing nursing. So it's okay to say no, especially again if you're new here. So there are certain procedures here, like for example, you do catheterization in your country and you didn't have the training yet here, so you can't practice it, even giving IV medications, even cannulation, taking bloods. You need to go through certain training first before actually doing a skill. So for example, a doctor asks you, hey, can you bleed this patient? Yes, you can. But if you didn't have a training yet, tell them that no, I don't feel I'm not yet allowed. Or if you're not confident with a skill, then tell them, oh sorry doctor, I'm not confident with that skill. So they're fine with it, trust me. It's fine. Like, most of the doctors will understand it, and also it's for your safety. I know you might be a nurse for a long time in your country, but still I know that feeling. When I was still new, like, oh my gosh, I can do that, like we do that, but no, you can't really do it except if you had a training. That's for your safety. So please be very careful when you practice nursing here, that if you're not confident, if you're not trained, then that's fine. Just say, I'm not trained, I'm not confident, it's okay. So yeah, and the last one, and the most important thing, and probably the best lesson I've learned while staying in A&E, be safe in terms of documentation. So document everything, like literally everything. Here guys, there might be some issues, especially for example A&E. You move the patient and the patient became unwell, or there has been pressure source that has not been documented. That would be your fault. So make sure to document everything. So I have a scenario before wherein this patient was like kinda sick and he needs to be on surgery, and he's scoring high in EWS. So EWS is like early warning score. So it determines if they're scoring high, then they're probably risk of like deteriorating. So I'm kinda not happy because like the porter is there, and like one of my HAs are like also like, okay, we gotta move the patient, but like he is scoring 7 and he had been scoring high previously. So I'm not confident to move that patient, especially I'm going to discharge him. Like wait, no. I need to ask my coordinator and I need to ask the surgical doctors to review the patient before actually moving if they're happy. Because if they said okay, they're happy, I will document that even though the patient is maybe scoring high. If it's been documented that, hey, I've consulted the surgical doctor and he's fine or she's fine with it, then that's fine. You know, I wouldn't do it just because of the pressure. Be very careful, document everything. Especially A&E, it's a fast-moving department. Some of your coordinator might pressure you to like, hey, move this patient, but you're the nurse and that's your pin. If you don't think that patient is safe, then don't move it. Document everything. Also regarding safeguarding, if you think that patient has been has a domestic abuse that's happening, blah blah blah, document it, do proper referral. Everything here needs to be documented, because if they do an audit check, or like if something happens for that patient, they're gonna read back on your notes and, oh, okay, he did this thing, so that's fine. So again, guys, be safe, be very safe. You'll know these things as you go along and practice your nursing here, but I guess those are the top 2 tips that I am able to give you. I think that's all what you need, and then everything else, you're gonna be fine with it. So first, again, don't be afraid to ask, and number 2, practice safe nursing. It's not only for your patients, but most especially for yourself. So yeah, I think that's it really. I hope you guys find this video helpful. It's kind of short because I want to just give you like the main things that you need to know in terms of practicing nursing in a new country, especially here in the UK. Again, guys, if you find this video helpful, please give it a thumbs up. Also comment down below if what topics do you want me to touch. And as always, thank you for watching, and don't forget to subscribe if you're not yet subscribed. Again, guys, see you again on my next video. Bye!